My name is Angelica Espinoza. I will be going over coping with negative body image from body failure. My research questions are: what are coping strategies for individuals who are struggling with self-image due to an experienced body failure? In this case, body failure would be considered anything regarding the body that happens to an individual that makes him or her feel that their body has failed them. This topic became important to me after I had my son. I was in and out of the hospital for about the first 2 months, and the doctors couldn't figure out why I was having infections and why my infections had spread to my liver and my kidneys. It took the doctors about 2 months to figure out what had happened, but during this process, my confidence went down a lot because I couldn't really do anything. I couldn't get myself out of the bed, I couldn't shower by myself, and I really didn't want to. So this made me want to know how other people experiencing body failure have coped with it. There is a lot of literature out there on body failure and how it affects people, but I will be going over 5 pieces of literature. The first piece of literature is by Lewis and Arbor. In 2015, Lewis and Arbor did a study of end-stage kidney disease, and they studied how this might affect relationships. They hypothesized that there will be an effect in their people's identity, ultimately causing an effect in their relationship. They did this by conducting 60 to 90 minute open-ended questions, and they gathered 40 young adults from the ages of 16 to 30 years old who experienced this kind of body failure. And from there, they separated the participants into 2 groups. One was the prepubertal group, which was from birth to 11 years old, and the other group was the postpubertal group, which was from 12 to 19 years old. They found that 95.65% of their participants experienced being teased or bullied at school. Also, some participants from the postpubertal group reported having felt really self-conscious and not wanting to go out of their house. With these findings, they concluded that there is an effect in intimate relationships, and this ultimately creates a barrier for family formation. The next piece of literature is by Winch, Sherman, Smith, Kohlmeyer, Mackey, and Boyages. In 2016, they did a study on women who had lower limb lymphedema, and they studied how this body failure affected their self-perception. They hypothesized that these women were more at risk for negative sexual self-esteem as well as self-schema. They gave these women the option of doing an interview over the phone or in person. They gathered 22 women in total. They found that 31.8% of these women had problems feeling attractive or confident, and they found that 18% of these women were embarrassed because they felt like they weren't meeting the social norms or expectation. 45% of these women also felt embarrassed to get naked when engaging in sexual activity. With this, they concluded that having lower limb lymphedema raised threats to confidence and appearance. The next piece of literature is by Rosenstrom and his colleagues. In 2013, they studied how chronic dysphoria affected body dissatisfaction. They hypothesized that there is an association between the two. So they gathered 1,057 individuals, and over the course of 16 years, they were examined 4 times. They were assessed for depressive symptoms using a modified version of the Beck's Depression Inventory, as well as for personality using the Temperament and Character Inventory. Through their study, they found that there wasn't a strong association between the two conditions, the chronic dysphoria and body dissatisfaction. And with this, they were able to conclude that body image dissatisfaction and depression are strongly related. The next piece of literature is by Roskaya and Holland. In 2017, they studied how disabling health conditions in older adults affected their body satisfaction. And they hypothesized that there is a correlation between the two. They were able to gather 274 adults over the age of 60. These adults had no reports of dementia or other cognitive disorders, and they were given questionnaires to assess body appearance, health, depression symptoms, physical functioning, as well as somatic symptoms. They found that over 50% of their participants were unhappy with their weight and shape, and 36% of the participants were unhappy with their appearance. With these results, they were able to conclude that somatic symptoms were a strong predictor of body dissatisfaction. The next piece of literature is by Theo and his colleagues. In 2016, they studied the self-perception and life quality of individuals who had breast cancer. They hypothesized that the timing and stage of the breast reconstruction were going to be an influence on the psychosocial outcomes, which were the self-perception and life quality. They gathered 216 patients. These patients were then divided into 4 groups: a pre-reconstructed group, a completed stage 1, completed stage 2, and final stages of reconstruction. They used the body image scale so they can measure the body satisfaction of the patients, as well as the functional assessment of chronic illness therapy to measure their quality of life. They found that body image dissatisfaction had higher levels when the participants had an immediate reconstruction rather than wait to have the reconstruction. With this, they were able to conclude that levels of body dissatisfaction can be predicted by taking into consideration the timing and the stage of the reconstruction, but well-being could be predicted by taking into consideration the stage of reconstruction. These articles all talk about very different conditions, but we can put them together to show a common theme of how these individuals who experience different types of body failure had an effect in their physical and emotional health. The only thing that these articles didn't talk about is how the individuals who were affected by their body failure coped with their body failure. So for my research method, I decided to do interviews. I chose interviews because I felt that this would allow my participants to feel more comfortable, especially since this is a sensitive subject. Also, I felt that I would get more honest answers and honest experiences from these individuals, as well as give me the opportunity to ask questions if I needed clarity on something. This type of research method is appropriate for my study because, as Little and McGivern stated in their book, researchers benefit from gaining a subject's trust and from empathizing or commiserating with the subject, as well as listening without judgment. And also, the participants are free to respond as they wish without being limited by predetermined choices. For my methodology, I engaged in snowball sampling, which is when the researcher recruits their subjects amongst peers or acquaintances. I turned to a competition team that I was in while I was in high school, and I was able to get 5 participants. 40% of them were female, 60% were Hispanic, 20% were Caucasian, 20% were Asian, and all my participants were from the age of 20 to 25, and they all attended a university or have already graduated. I conducted roughly 45 to 60-minute semi-structured interviews. These interviews consisted of 5 open-ended questions. After I finished my interview, I went through my data and I began to code it, looking for keywords or phrases, which were depressed, treated differently, ashamed, no control, and negative or negatively. From the literature that I read, I was able to hypothesize that individuals with body failure were going to have a negative self-image. However, I was not sure what to expect in terms of coping strategies. Some difficulties that I encountered in my research was that I couldn't find a larger sample size to interview, and this ultimately limited my research. In my findings, only taking into consideration self-image from the body failure, I found that males experience higher levels of being treated differently, of being embarrassed, and of having more negative feelings. A lot of my male participants asked themselves what was wrong with them, and they reported being bullied by their older brothers for having this body failure. The females in my study experienced higher levels of depression. They experienced this because they were bullied by other girls, and a lot of them were ashamed and wanted to hide in their home and not go out at all. In terms of coping strategies, I found that 60% of my participants engaged in suppression, and only 20% of those participants were a continuous suppression. So until now, they still suppress themselves from thinking or feeling anything that has to do with their body failure. 80% of my participants coped by talking to a friend or a family member about their feelings, and 20% turned to professional therapy, as well as 20% engaged in some sort of physical activity such as running or riding a bike. Overall, my participants regarded body failure as breast cancer in male, infertility in women, psoriasis in male, eczema in female, paralysis of the lower limbs in male. All of them shared a common theme of blaming the victim. This usually happens when society blames an individual for having a certain condition or disease. However, the individuals were the ones blaming themselves. All of my participants had negative experiences with their body failure, and 3 individuals became depressed from their body failure experience. Some participants engaged in the same types of coping strategies or tried more than one strategy. For example, some initially suppressed their feelings and thoughts and ultimately ended up getting professional help or talking to a friend or a family member to cope with their feelings about their body failure. Overall, the literature agrees on the negative relationship between body failure and self-image. And some of my limitations for my study were that I had a small sample size. I would have liked to have a bigger one. For further research, I would like to see how this varies between socioeconomical statuses, and I would like to see how cultural views on health have an impact on how the body failure affects body image.